Imagine being told you have cancer, hearing that single word echo in your head while everything else fades into background noise, and then almost immediately being flooded with information, options, opinions, fear, hope, statistics, survival rates, miracle stories, horror stories, and promises of cures. Because cancer is no longer just a disease, it is an entire universe of treatments, technologies, and expectations. And yet the truth most patients don't realize at the beginning is this: cancer treatment is changing faster than almost any other area of medicine, and what was considered standard, aggressive, or even life-saving just 10 years ago may now be outdated, unnecessary, or even harmful for certain patients. And this rapid evolution is both a reason for hope and a source of confusion, because while modern cancer treatments have genuinely transformed survival for many people, they have also created a landscape where more treatment does not always mean better outcomes. And understanding that balance is one of the most important things a patient can do today, because cancer treatment is no longer just about killing cancer cells. It is about understanding biology, timing, risk, benefit, quality of life, and the reality that not all cancers behave the same way, not all patients benefit from the same therapies, and not all new treatments are automatically better. And this is where many patients feel lost, because from the outside, cancer treatment still looks like chemotherapy, radiation, and surgery, but on the inside, the philosophy of treatment has shifted dramatically, moving away from a one-size-fits-all war on cancer toward a more personalized, targeted, and sometimes surprisingly restrained approach. And to understand what patients must know today, we need to start with a fundamental shift in thinking. Cancer is not one disease, and treating it as if it were has caused enormous harm in the past, because cancer can be fast-growing or slow-growing, aggressive or indolent, genetically driven or environmentally influenced. And some cancers will threaten life within months if untreated, while others may never cause symptoms even over decades. Yet historically, medicine treated almost all cancers with the same urgency and intensity, driven by fear, limited tools, and the understandable desire to do something, which led to an era where aggressive treatment was often equated with good care, even when evidence of benefit was weak. And this mindset is now changing because decades of data from the USA, the UK, and other countries have shown that overtreatment can be just as harmful as undertreatment, causing long-term side effects, reduced quality of life, and in some cases, no meaningful extension of survival. And this realization has reshaped cancer care in profound ways, beginning with the way cancers are diagnosed and classified, because modern oncology no longer looks at cancer purely by where it starts in the body, but by its molecular and genetic characteristics. Meaning two cancers that look identical under a microscope may behave completely differently depending on their genetic drivers. And this has opened the door to targeted DNT therapies, treatments designed to interfere with specific molecular pathways that cancer cells rely on, rather than indiscriminately killing rapidly dividing cells like traditional chemotherapy. And for some patients, these treatments have been revolutionary, turning once fatal cancers into manageable chronic conditions, extending life by years rather than months, and doing so with fewer side effects. But for others, these therapies offer little benefit. Highlighting an uncomfortable truth: precision medicine is powerful, but it is not universal. And this is where patient expectations often clash with reality. Because headlines celebrate breakthroughs, but rarely explain that these breakthroughs apply to specific subgroups of patients. Not everyone with a cancer diagnosis, and understanding whether a treatment applies to your specific cancer biology is now far more important than simply knowing the name of the drug. And alongside targeted therapies, immunotherapy has emerged as one of the most transformative developments in cancer treatment, shifting the focus from directly attacking cancer cells to empowering the immune system to recognize and destroy them, And for certain cancers, immunotherapy has produced dramatic, sometimes near miraculous responses, leading to long-term survival in patients who previously had few options. Yet, immunotherapy is also one of the most misunderstood treatments, because while it can be life-changing for some, it does nothing for others, and can cause serious immune-related side effects that affect the lungs, liver, gut, skin, and endocrine cysts, sometimes permanently. And this again reinforces a critical message patients must understand. Newer does not automatically mean safer or better, and every treatment decision must weigh potential benefit against real risk, not hypothetical hope. And this balance becomes even more complex when we consider how cancer treatment is increasingly influenced by early detection and screening. Because as screening programs expand and imaging becomes more sensitive, more cancers are being detected earlier than ever before, including cancers that may never have caused harm. And this has forced medicine to confront the concept of overdiagnosis and overtreatment, where patients receive surgery, radiation, or drug therapy for cancers that would never have affected their lifespan. Yet once the label of cancer is applied, stepping back becomes emotionally and culturally difficult. And modern cancer care is now trying to correct this by embracing strategies like active surveillance, where certain low-risk cancers are carefully monitored rather than immediately treated, a concept that initially feels counterintuitive and frightening to patients, but is supported by strong evidence in specific contexts, particularly in prostate cancer and some thyroid cancers. And this shift represents a broader change in philosophy. Cancer treatment is no longer about doing everything possible. It is about doing what actually helps. And this requires honest conversations about uncertainty, probabilities, and patient values, because not every patient prioritizes maximum survival at any cost. Many prioritize Z, quality of life, independence, and avoiding long-term side effects. And modern oncology increasingly recognizes that these preferences matter just as much as tumor size or scan results. And this is especially important as populations age, because older patients often have multiple medical conditions, and aggressive cancer treatment may pose greater risks than benefits. Yet, historically, age alone was either used to deny treatment or justify overtreatment. Whereas today, the focus is shifting toward functional status, resilience, and individualized assessment, allowing more nuanced decisions that reflect the patient's overall health rather than a single diagnosis. And another major change patients must understand is the role of clinical trials, because many of today's standard treatments were yesterday's experiments. And participating in a clinical trial is no longer a last resort, but often a way to access cutting-edge therapies under close monitoring. Yet trials also involve uncertainty. And not every trial offers direct benefit to participants, making informed consent crucial. Because hope should never replace understanding, and patients should feel empowered to ask what is known, what is unknown, and what alternatives exist. And beyond drugs and procedures, cancer treatment is also increasingly recognizing the importance of supportive care, including pain management, psychological support, nutrition, physical rehabilitation, and palliative care, not as a sign of giving up, but as an essential component of comprehensive treatment. Because studies consistently show that early integration of palliative care improves quality of life, symptom control, and sometimes even survival. Yet many patients associate palliative care with end of life, delaying its benefits unnecessarily, and this misunderstanding highlights how outdated perceptions continue to shape cancer experiences even as treatments evolve. And at the same time, the explosion of information online has created a new challenge, where patients are exposed to unproven therapies, exaggerated claims, and misinformation, often marketed as natural, alternative, or hidden cures, exploiting fear and desperation. And while patients absolutely deserve transparency and choice, they also deserve protection from false hope. Because evidence-based cancer treatment is not perfect, but it is grounded in rigorous testing. Whereas unproven therapies often offer nothing but financial and emotional harm, and this makes critical thinking and trusted sources more important than ever, because cancer treatment today is not just about what doctors recommend, but about how patients navigate an overwhelming landscape of information, options, and emotions. And perhaps the most important shift of all is the recognition that cancer treatment is a journey, not a single decision. Because treatments change as cancers evolve, responses vary, side effects accumulate, and patient priorities shift over time, meaning that good cancer care requires ongoing reassessment, communication, and flexibility rather than rigid adherence to a predetermined plan. And this dynamic approach represents progress because it acknowledges complexity rather than denying it. And it respects patients as partners rather than passive recipients. And while cancer remains one of the most feared diagnoses in medicine, it is also an area where progress is real. Survival is improving, and understanding is deepening. But only for those who are informed, engaged, and supported. And if there is one thing every patient must know today, it is this: cancer treatment is no longer just about fighting disease. It is about making informed choices that balance length of life with quality of life, hope with realism, and innovation with evidence. And those choices are best made when patients are empowered with clear, honest information rather than fear-driven narratives. And if you value this kind of calm, evidence-based, patient-focused explanation that helps you understand what modern medicine can and cannot do, then make sure you subscribe to MedLogic, because this channel exists to guide you through complex medical topics with clarity, honesty, and respect, helping you make better decisions for your health in a world where medicine is changing faster than ever.